Real Country 1430 AM and 107.3 FM WRDN. Good morning. I'm Brian Winnekins, and joining us this morning is Ingrid Kundinger. She is the project manager for the Senior Medicare Patrol Program. And we are going to talk about Medicare Fraud Prevention Week. That's going on this week. Ingrid, thank you for joining us this morning. Well, first, tell us about the Senior Medicare Patrol Program. What does that do?
Great question, and thank you so much for having me. The Senior Medicare Patrol Program is a nationwide program available in all 50 states across the country. And the mission of the Senior Medicare Patrol Program is to educate and empower Medicare beneficiaries, their family members, and caregivers to protect themselves from Medicare fraud, to detect if anything maybe suspicious has happened, and then to provide information about ways that they can report if they think something is a little bit sketchy. So we operate this program here in Wisconsin. We do a lot of presentations, outreach events, and we also operate a toll-free helpline that people can call if they have questions or concerns, or maybe they just had a funny phone call that they got a kind of weird feeling about. They can give us a call to talk through that information.
When it comes to Medicare fraud, the most obvious one is these phone calls or text messages that we get, and there's a problem with your account and we need your information to verify stuff. And that's probably the most common one that at least I've seen before. And that's not how the system works. If they need information, they're not going to just call you out of the blue or text you, right?
That is absolutely right. You hit the nail on the head with that whole explanation. And the scammers are calling and they're looking for people's information. You're absolutely right. Medicare is not ever going to call people to ask them for information or to verify their information. They have your information, and if there were ever any concerns about your Medicare account or your Medicare benefits, you would receive notification from Medicare via the United States mail with information about what you would need to do to correct that problem or how you would contact them. So most of the Medicare related fraud and scams, as you said, does happen over the telephone with people who are maybe impersonating someone calling from Medicare. That provides them with a little bit more legitimacy. If they say, hey, I'm calling on behalf of Medicare, I just need to verify your Medicare information to double check your benefits. We really encourage people to be extra cautious on the telephone in sharing any personal information. That would include your Medicare number, as well as your Social Security number, any bank account information, any credit card information. Our best practice is always to tell people to just never share any sort of personal information over the phone with someone who calls you out of the blue that you've never talked to before, that's asking you personal questions, health information, verifying information. Like, those are big red flags. That's going to likely cause you more trouble in the end than it's worth. And we really encourage people to simply hang up the phone on those folks.
Talking with Ingrid Kundinger. She's the project manager for the Senior Medicare Patrol Program here in Wisconsin. Now, Ingrid, okay, so Medicare uses the United States Postal Service. Scammers know this, and sometimes they might even try sending, a letter. Oh, looks official. It's got a little seal and this and that, and in fact, it's not. So how do we know if someone gets something in the mail that this is fake compared to the real thing?
Sure, great question. So we would encourage people, if they did receive information in the mail from Medicare, that they would, before kind of following the instructions, just to make sure that it is, they can either call the Senior Medicare Patrol. We can kind of walk through what that mailing is and what it might look like and answer any questions about that. Or we always encourage people to call Medicare directly. There's a toll-free number to Medicare that folks can call, and you will be asked to verify that it's you that the customer service representative from Medicare is speaking with, but then they will be able to answer any of your questions. They will be able to say, no, ma'am, we did not mail you any sort of information, that you can shred that. That's not in fact true. Or yes, according to the information in your Medicare account, there was a question and here's what that question might be. So unfortunately, we always need to be cautious, not just on the phone, but also in terms of the mailings that we receive as well.
And Ingrid, you mentioned call the Medicare. There's a Medicare hotline, but don't call the number that letter says.
Correct.
Because they're waiting for you potentially.
Yes.
If these are the bad guys, they're going, okay, we know what they're going to do. They're going to call the number and we'll give them an 800 number. And that's the one they'll call was, oh yeah. And now they've got you. So you have to actually, I'm here in Western Wisconsin. Okay. There's the Social Security Administration office in Eau Claire. We could call that office, right?
Yep, absolutely. That's a great point that you make as well, is that anytime if maybe you've gotten a phone call and they've left a message with a toll-free number for you to call, saying that it's Medicare or something else, we encourage people to do their own homework and look up that information directly and make sure that it truly is Medicare or the Social Security Administration or whomever it is that you think you're calling, that it truly is. Because unfortunately, at least on the phone, the scammers have technology available to them where they can spoof the number. So maybe it comes up on your caller ID that says they're calling from Medicare. They do that because they're hopeful that their likelihood that you're going to answer that phone call increases, because you think, oh my goodness, Medicare is calling me. I better answer that call because I don't want anything to be not quite right with my Medicare benefits. So unfortunately, we just have to be really careful. If you are a Medicare beneficiary, the toll-free Medicare number, the 1-800 Medicare number, is listed on the back of that Medicare card, and you can contact them directly. Similarly, you can always go on to the website for the Social Security Administration to find out where the local office is nearest you. As you mentioned, for Western Wisconsin, there is an office in Eau Claire, and to make sure that you have the information and know that you're calling. Similarly, a lot of fraudsters will call and they're spoofing maybe your local clinic or doctor's office number on the phone. And so again, we would encourage you to go online or pull out a phone book or look on a statement that you received from your healthcare provider to call directly back to them to make sure that there wasn't something that you missed as it related to that.
Talking with Ingrid Kundinger, she's project manager for Senior Medicare Patrol Program here in Wisconsin. I guess, Ingrid, I while you were chatting, I even thought that, for some folks, they might even be nervous about trying to call, or, they don't want to call an 800 number. A lot of times, if they have a question too, they could just even go right to their local ADRC office. Those folks are going to be able to absolutely help them out right there, or even say, you know what, let's call together. Yep. And I'll help you through it.
Yep, absolutely. We work directly with the Aging and Disability Resource Centers across the state of Wisconsin. We make referrals back and forth to make sure that people get the assistance that they need as it relates to their Medicare benefits. And similarly, if someone were to call the Senior Medicare Patrol toll-free helpline, and my suggestion to them would be to call Medicare. If they're uncomfortable or they're unsure of that, I can certainly initiate a phone call together with that Medicare beneficiary so that we can kind of go through that together. As you mentioned, some people are a little bit nervous about that, or maybe they haven't called before, or they're unsure of all the different questions that they're going to have to answer. It can be a little bit overwhelming. And so absolutely, we would certainly be happy to make that phone call together, at least for the first time, so that people are more comfortable doing that.
And what is the 800 number for the Senior Medicare Patrol Program?
Sure. The toll-free number here in Wisconsin is 888-818-2611.
So that's 888-818-2611. Again, 888-818-2611. We're talking with Ingrid Kundinger. She's project manager for the Senior Medicare Patrol Program this morning. It's Medicare Fraud Week, Fraud Prevention Week this week. Ingrid, what about, we talk about the scammers a lot, but I've also, in my years in working in the media, have had stories on a provider that really isn't on the up and up. And that can adversely affect Medicare benefits if that person is not playing by the rules, so to speak. So how do seniors try to follow this? Because that's, now we're talking about billing and rates. And so how do they follow this?
Sure, that's another great thing to think about. And we always encourage people, that kind of goes along with our detect message that we talk about. And we really encourage all Medicare beneficiaries, and actually all of us, whether we're Medicare beneficiaries or not, to be really good healthcare consumers, conscientious. That means that we're looking closely at all of the statements that we receive, either directly from Medicare in terms of a Medicare summary notice, or if someone has a Medicare Advantage plan or from their Part D prescription drug plan, they would receive explanation of benefit statements. So either of those statements are going to provide an accurate, or hopefully an accurate, listing of all of the claims that were filed with that person's Medicare information during a certain time period. So and they can be confusing. There's a lot of pages. We encourage people to take the time to become familiar with those statements. The reason being that that is where they would be able to identify if perhaps their provider was, maybe it was an error. We're always going to give the provider an opportunity to correct something first. But in some situations, maybe that just becomes a new billing practice that the provider has kind of stumbled upon, realizing that they can either get a higher reimbursement rate for Medicare, or they can get away with maybe double billing because people aren't looking at their statements. So when we're opening those statements and really taking the time to make sure that they're accurate, we're going to see things that stand out to us. Maybe it's something, a service or a supply that we didn't ever receive. Maybe there's a double billing. Maybe you went to get your flu vaccine and it was listed on your statement twice. Maybe there were other things on there that were not accurate coding. That's where we're going to say, take a look. If you see something that doesn't seem right, say something to someone. If you're comfortable calling the provider directly to get further clarification from that, we would encourage you to do that. Most of the time, if it is an error, when that's brought to the attention of the provider, they're going to do whatever they can to get that fixed quickly, because they certainly want to continue to be in good standing with the Medicare program. The red flags go up when you get a lot of runaround, or maybe you just never get resolution, or you're never able to truly talk to someone about those suspicious claims or things on there that you just aren't remembering correctly as what happened. And in that case, we would say, give us a call. We're going to talk through maybe some additional questions. Maybe there's someone else we can recommend you try to reach with that healthcare provider. And at the end of the day, if we aren't able to get that resolved, we can submit that for additional investigation at the federal level to make sure that that provider is, in fact, as you said, following the rules and not attempting to commit Medicare fraud.
Again, that number for the Senior Medicare Patrol Program here in Wisconsin is 888-818-2611. That's 888-818-2611. Ingrid, what about family members? My mom, she's 87. She still can handle a lot of the things for her finances and all that. She still understands all that. But for family members with senior parents, what do we need to be looking out for?
Sure. We always encourage family members to just, again, always remind their older parents or their loved ones about the importance of keeping their information safe over the phone. So things to think or listen for would be if your mother or father or whomever, your loved one is talking about strange phone calls that they maybe received. That gives you an opportunity to remind them how important it is to keep their information safe. And, that generation, they're not 100, they like to take people at face value. And we certainly all would love to do that. But unfortunately, in the world that we live in, we can't always do that. And so that would be a great opportunity to remind your loved one the importance of keeping their personal information to themselves. Oftentimes we receive phone calls from adult children who say, hey, I'm just visiting my mom, and there's suddenly a package of medical supplies that she didn't ever order, didn't need. It's sitting here on the, in her hallway closet. What do we do about that? And so that's an opportunity to, remind folks how important it is to look at their statements to make sure that there wasn't a suspected or a suspicious claim filed to Medicare for that equipment that shouldn't have been. Again, if that happens, we'll do what we can to get that investigated. And then we'll also do what we can to get that product returned to the likely fraudulent company that sent them to them. So just being aware of those sorts of things, and maybe even, I know sometimes people are very private about that, but just asking if you can take a peek at the Medicare summary notice or the explanation of benefit statements, just as an overview to make sure that all of the providers' names that are on there are someone that's familiar to you, or at least happen within the healthcare system that your loved one goes to. I mean, sometimes those are pretty obvious. If you're someone that lives, in Eau Claire, Wisconsin, and suddenly you have your Medicare summary notice, and there's a bunch of places that are submitting claims to Medicare from North Carolina, and you didn't travel to North Carolina, or you've never dealt with a provider in North Carolina, that would be a red flag that someone maybe has access to your Medicare information, and we need to get that taken care of. And then they can reach out to the Senior Medicare Patrol, and we'll kind of talk through what the next steps would be.
Again, the Senior Medicare Patrol program number in Wisconsin, 888-818-2611. That's 888-818-2611. That's Ingrid Kundinger. She's project manager for the Senior Medicare Patrol program here in Wisconsin. You're listening to Real Country 1430 AM and 107.3 FM WRDN.